The month of March is Brain Injury Awareness Month, so today we are talking about the impact of brain injuries and the importance of prevention and recognition as well as education. Today we are joined by Dr. Nathan Rowland, a neurosurgeon at the Medical University of South Carolina, who will help us understand the signs and symptoms, Dr. Rowland, of brain injuries, as well as how we can reduce the risk of suffering a brain injury in our daily lives. So Dr. Rowland, so good to have you here in our studio.
Thank you very much for inviting me.
We know your time is very valuable, so we appreciate this time. So what are the most common types of brain injuries that people should know about, Dr. Rowland?
Absolutely. So brain injuries, all of them can be categorized into three types. That's mild, moderate, and severe. And where you end up on that spectrum depends on what mechanism caused you to have the brain injury. So people with concussions are mild traumatic brain injury patients. Those in a coma on the other end are severe traumatic brain injury, and those in the middle are moderate.
So when we think about increased awareness, how does that contribute to our ability to prevent having a brain injury?
It's very important to know about what these brain injuries are and how to prevent them. And we sort of think about those in threes. So we think about young students, athletes, adolescents, young adults. They need to wear those helmets and be able to try to prevent a lot of the falls that we kind of think about that lead to mild traumatic brain injury. So we think about seniors with fall mitigation risk, being able to use canes, walkers, whatever your professional, your diagnosis, whatever your physician or physical therapist are recommending that you do to prevent falls. And then we think about drivers, operators of heavy equipment. Using seatbelts is going to be the best way to prevent a severe traumatic brain injury. You know,
it's real easy to, when you think about brain injuries, you think about concussions, but you just described that everyone really is at risk because someone certainly could fall. You think about cheerleaders, you think about athletes.
Yes.
The age range is significant. It's throughout our lifetimes.
Exactly. And the other category that a lot of people forget about, but we have to consider our military veterans and those serving in the armed forces. That's another category or demographic that we really have to think about. What are the risks? What are the mitigation strategies for preventing not only traumatic brain injury, but dealing with some of the consequences when they return home?
Dr. Rowland, there's an exciting event that's happening toward the end of the spring during the month of May. We're talking about a brain health awareness campaign that you are organizing. Can you tell us more about that and how people can get involved if they're interested?
Absolutely. May 30th through 31st, that's the Friday and Saturday, end of May. That is our annual Mind Conference. If you have any brain diagnosis at all, be it Parkinson's disease, stroke, brain injury and recovery, depression and suicide, mental wellness, addiction, all of those, there is a home for you at our Mind Conference. To register for that, you're going to go to mind2025.org. Again, that's mind2025.org. You'll be able to interact with physicians, healthcare providers, therapists, other patients, vendors. It's an amazing time for anyone with a brain diagnosis of any of the sort. Stroke, again, all chronic pain. We would love to have you. We'd love to see you there and love to hear your story.
We will be there. One of the things that I'm excited about is the connection between the brain and our gut health and what we eat and how that helps fuel our brain.
Yes, exactly. So the brain and the gut are connected, and what we understand now is that the gut and the makeup of the microbiome or the gut microbiome determines how our brains function. So even recovery from brain injury is determined by our nutrition, nutritional health, and a lot of that will be discussed at this conference. So I'm glad you brought that up.
Yeah, very excited about it. Dr. Nathan Rowland, thank you so much for your time. We appreciate it. And again, if you would like to find out more about the Mind Conference happening later this month, you can go to MUSC. And again, that website, Dr. Rowland?
Mind2025.org will lead you to the registration website.
All right, stay with us. There's more of News 2 at 4 after a quick break.